Welcome to your first lecture for ATR 102. This is Risk Management and Emergency Response. I hope that by taking this course, you will be able to gain knowledge, skills, and confidence to provide appropriate care when you are called upon in an emergency situation to help or care for a person who has sustained either an injury or some type of sudden illness. I am Dr. Cosby. I am the professor and the online lecturer for this course. We will begin this course with discussion on chapters 1 and 27 in your text. To me, these two chapters really provide the foundation for which we will build upon for the entire semester. So should you have any questions about this lecture or other lectures that will proceed, please feel free to email me at nicolecosby@pointloma.edu. We will start with discussing the Emergency Medical Services System, or as I will refer to it for the rest of this class or this lecture as the EMS system. The EMS system was truly designed to really provide efficient and higher quality of care to our patients that we would be caring for. Some of the interesting things about the EMS system is really that each state within the United States controls its own EMS system. However, the standards for each state are set by the National Highway Traffic Safety Administration, which is really housed in the United States Department of Transportation, or what we'll call DOTS. So the standards are pretty much consistent across the board. However, each state does have the ability to regulate its own EMS system. So we think about the EMS system, what we really think about is this network of community resources and medical personnel. The biggest medical personnel that we'll really talk about is the emergency medical responder, right? Or the EMR. That would be you. By the time that you leave this course, you will be equipped and you will be skilled to provide care in an emergency situation. So what we see about the EMS system is that it truly was developed to provide a higher quality of care to our patients, specifically in an emergency medical situation. And this EMS system, regardless of which state we go to, is comprised of 10 different components. So we're going to discuss those 10 different components because they really are important. Our first stop within the 10 components in the EMS system is, to me, the most important, which is regulation and policy. What this really deals with what it really states is that each state must have laws, it must have regulations, policies, and procedures that govern its emergency medical services system. Well, why do we think that regulation and policy might be an important component? Well, it's the biggest factor of them all because it truly allows emergency medical responders to know the state laws, to know the state regulations, to know their operational procedures. It's when we don't have a regulation and a policy set that we tend to have chaos in an emergency situation. So we really truly need to know the laws and the policies and procedures within the state that we are operating or working within. I think the second biggest component to the EMS system are trauma systems. One of the biggest issues with emergency medical situations is when a state or a country doesn't have trauma systems set in place. So when I'm referring to trauma systems, really what I'm saying is that each state must develop a system of specialized care for trauma patients. And this must include at least one or more trauma centers and rehabilitation programs that are equipped to deal with trauma patients. And if a state does not have one of these trauma systems in place, then they are required by law to do so if we're working within the EMS system. Medical oversight or medical direction is another big component to the EMS system. What medical direction states is that every EMS system, regardless of the state, must have a physician as the medical director. So the physician really plays a huge role in dictating care, in evaluating patients, in determining where our patients will go in an emergency situation. This physician must be a board certified physician recognized by that particular state. Now, of course, the other 7 components within the EMS system are vitally important, but I think as first responders, specifically as athletic training majors, the 3 most important components are the trauma system, medical direction, and regulation and policy. However, we could see that if communication breaks down or if we don't have individuals who are skilled, who are certified, who are up to date in their certifications, how the EMS system might break down when we have an emergency situation. All 10 components together, combined, when they are efficient, when they are effective, really provides for an effective emergency system that is capable of providing high quality of medical care, which is the number one goal of an emergency medical system. So the chain of the survival really consists of 6 important factors, all of which we'll talk about individually. But I think at this point in time, I really want to reiterate that the chain of survival is a lot different than the cardiac chain of survival, which we'll talk about when we get to cardiac emergencies. But the big 6 steps that we see here and that we'll discuss in detail really is citizen response, early activation of the EMS system, the first responder care, which would be you. This is where you come in. So first responder care, which is where you come in, right? This because you are going to be deemed a first responder, someone who's capable of performing CPR, first aid procedures, delivering oxygen to patients who might need it, right? And then at some point in time, we tend to transport our patients, and our patients get transported to the emergency room, which is where more advanced out-of-hospital care comes in. Eventually, they get out of the ambulance and they are cared for at the hospital. And then last but not least, they kind of come back to us as athletic trainers, right? And we perform rehabilitation with the goal being to return our patients to at least 90% of where they were before they actually leave us. So the chain of survival is important for many reasons. The biggest reason that I talked about with the 10 components of the EMS system really truly is just to make sure that we are efficient and effective, and that we are getting EMS or EMRs, emergency medical responders, to respond in a timely manner. So the first stop on our journey is the citizen responder. The citizen responder is, that person who knows absolutely nothing about an emergency whatsoever. However, what they are capable of doing, hopefully, is recognizing that an emergency has occurred, right? So what is the role of the citizen responder within the emergency medical systems? If I had to sum it up, I would say, they are the person. They are the main person who recognizes that an emergency has occurred, and they are mainly responsible for initiating EMS or for calling 911 if it is even possible, right? And so when we think about step number 2, which is this early activation of EMS, this occurs when we have a citizen responder who recognizes an emergency has occurred and calls EMS right away, right? They get the domino effect going. The citizen responder is capable of providing only basic care to our patients. So they might be able to put pressure on a wound that is bleeding, but they are in no way certified in CPR or first aid. They are in no way certified in AED or oxygen administration. That would be you, my friends. So as I mentioned, we have the citizen responder who recognizes that an emergency has happened, right? And then they call 911. So the idea is that with the recognition of an emergency, we get the EMS system rolling. We call the dispatcher, and then hopefully the dispatcher decides that which kind of help is needed and sends the appropriate help to the scene. Now, what's interesting is that I was working a football game. I had a football player who took a hit down the middle and became unconscious midair. When he dropped to the ground, he continued to be unconscious. I called 911. And the interesting thing is that I was actually placed on hold for 2 minutes. So you can imagine how frustrating that might have been in that emergent situation. However, sometimes what we need to realize is that when we call 911, our phone call may not be addressed right away. So we have to take that into consideration. If you call 911 and you get placed on hold, please do not hang up. The dispatcher will take care of you in the order in which you called. I'm sure we've all heard that before when we're calling our cell phone company, right? And we have a problem with our phone. So just hang in there and just try to be as patient as you can. So we've talked about the citizen responder whose main job is to recognize that an emergency has occurred. And then the next step in that process is early activation or calling of 911 or the EMS system, right? So there are 2 different types of 911 phone calls that we generally make within the United States. And the first one is a true 911 phone call, and the other is a non-911 phone call. So really what it truly depends on is the type of event or emergent situation that is occurring. If it truly is an emergency, so something that is life-threatening, your victim or your patient is getting ready to die, then that warrants a 911 phone call. However, if it is an urgency, so your patient has deep or shallow breathing and is losing oxygen, your patient has what we would call a tib-fib fracture or compound fracture where the bone has pierced the skin, then that would be a non-911 phone call. right? And so when we call the dispatcher, typically they tend to rank the emergency or urgency on a scale of 1 to 10. And that will kind of dictate how fast or how soon EMS will arrive to the scene to help you or to assist you in an emergency situation. So some interesting facts about 911. This service was created in the United States in around 1968 as a nationwide telephone number for the public to use to report both emergencies and to also request emergency assistance. The interesting thing is that it gives the public direct access to an emergency communication center. So it's not like you're calling someone directly. It's actually like a call center. And this call center is responsible for really truly deciding what type of action should be taken based on the phone call that they received. So I think that's a little bit of interesting to me, that we have people on the other end of the phone deciding whether or not our emergency is emergent or whether or not it's urgent in nature. I also find it interesting that the numbers 911, how they were chosen. They were chosen because they best fit the needs of the public. They were easy to remember and to dial. And the interesting thing is that they had never been used as an office area or a service code. It has been estimated that about 200 million people call 911 each year. And at least 99% of the population and about 96% of the geographic United States is covered by some type of 911 service. Since the majority of the population, around, I think it's 50 million individuals in the United States, are now using mobile phones to call 911. So since the majority of the population in the United States are using cell phones, one of the questions that I always like to pose is, do you think that cell phones are helpful or are they harmful in an emergency situation? And it could be both, right? The benefits of having a cell phone is that they're very convenient. It allows you to activate EMS right away. However, one of the downfalls to a cell phone is that you really have no fixed location, right? So it becomes very difficult for the 911 dispatcher to actually locate you in the event of an emergent situation. So as we can see in this little paragraph below, one of the biggest obstacles truly is to locating a person in an emergency situation who is called from a cell phone is that what you find is that they give you the cell site that is closest to the 911 caller on the cell phone. However, they only provide a general indication of the caller's location. So it really creates an issue for either the ambulance that's arriving or the EMTs that are arriving, because they kind of have to make a guesstimation as to what your location might be. So there are suggestions from the EMS system that we will follow as first responders if we are going to use our cell phone to call 911. One of the newest laws that has been passed is this idea of enhanced 911. What enhanced 911 is a law that was passed requiring cell phone providers, so AT&T's, your Verizon's, your T-Mobile's, to actually allow callers to make a 911 phone call from any cell phone, regardless of if that person has a service or not. So another way stated is, if you have an old cell phone that has been turned off, you no longer subscribe to T-Mobile or Verizon or Sprint, that you would still be able to call 911 regardless of if you have a service or not. I think that's an awesome law because when I think about people who live in poverty and who cannot afford to, let's say, make the monthly payment on a cell phone, it still provides a way for people to access 911. One of the other interesting things about this enhanced 911 is it actually requires service providers to provide the service dispatcher with the telephone number of the originator and also with the location of the cell site. So now we're getting more sophisticated as more and more people start to use cell phones. What you are finding is that you can pinpoint the direct location of the cell phone user. One of the interesting things about crossing over, or the FCC crossing over into cell phones territory, really is a violation of privacy, right? When a person makes a 911 phone call from a cell phone, in the past it had been difficult to identify not only the location but also the wireless caller's cell phone number. And now what the FCC is requiring is that all wireless carriers and providers try and provide a more specific location. If, for whatever reason they cannot get a specific location, then it has been suggested that you as the wireless caller should recognize certain things. So you should be able to tell the dispatch the location of the emergency right away. That should include cross streets and or landmarks if you can see them when you were driving in. Then you want to give the dispatch your telephone number so that if something happens, if the signal should get cut off, they could call you back. The other thing that is awesome about this new enhanced program is that they recommend that you not program 911 into your phone. So you not save it. And the reason being is that now you can press the 9 key on your phone and hold it, and it will automatically call 911 for you. So several different rules that are designed to enhance, hopefully, the emergency response system as it relates to calling 911 from a mobile cell phone. It beats walking to a telephone and paying 35 cents, right, in order for EMS to get your exact location. After all, who has 35 cents in their pocket with the invention of cell phones? So the citizen responder arrives to the scene. They've recognized an emergency. They've called 911. If they are using a cell phone, hopefully it's enhanced 911. They've given cross streets. EMS is on the way. Hopefully by this time of calling 911 and the citizen responder recognizing that an emergency has occurred, maybe it's possible that a first responder has arrived to the scene. So what is a first responder? Well, interesting that you should ask. The first responder is going to be you. This is the person who is trained to provide a higher level of care than the citizen responder, i.e., they could provide oxygen administration, they could perform CPR, they could perform splinting if needed, if there were a fracture. You get my point. They are capable of performing any types of care that they are trained to provide and are certified to provide. So some examples of a first responder, I always like to go with my bias, which would be athletic trainers would be first responders. But in other situations, emergent situations, we also get firefighters, your law enforcement, i.e. your policemen or woman. Lifeguards are considered first responders because they should be certified in both CPR and first aid. And then if we're in the mountains and it's wintertime and we're skiing, your ski patrollers are also considered first responders. Now, of course, we could also throw other people into the category. Your grandmother, your sister, your brother, your father, your mother, they could all be first responders if they had the appropriate certifications, right? So I think that when we talk about first responders, I think it's important to note that they are not just limited to this list here, that a first responder is anyone who is trained to provide a higher level of care. So when I say higher level of care than a citizen responder, so that can be anyone who is certified. So after we've recognized that an emergency has occurred, after we've called 911, after this, a first responder who has at least higher training than the citizen responder, and 911 has arrived at the scene, we get to more advanced out-of-hospital care. And what more advanced out-of-hospital care, it really boils down to the fact that these individuals are capable of providing a higher level of care than a first responder and a citizen responder. And so when we think about professional levels of the emergency medical system, really there are 4 nationally recognized levels of training for pre-hospital emergency care. The first one is the emergency medical responder, and this is the individual who has basic knowledge and skills needed to provide emergency care to people who are injured or who have become ill in an emergency situation, i.e. Another way to say it, that would be the first responder. The next level of care, or the next higher level of care, would be our emergency medical technician. And if you look down here at the levels of training, what you'll see is that there are definitely levels of training. The higher the level of training, the more care that they can provide. But what we have is a situation where you would have an emergency medical technician basic, an emergency medical technician intermediate, and then the highest level of care, which would be an emergency medical technician paramedic. The major differences between the 3 categories or levels of training truly is that a paramedic can administer your IV medications, and so we kind of want them at the scene if we have a patient who needs to be sedated and or needs to be intubated. This would provide more efficient care before the patient gets to the hospital. What I think is important to know is that we all operate under a scope of practice, and that really is just defined as the range of duties and skills that we as first responders are allowed and expected to perform when necessary, while using reasonable care, think about that, and skill according to our level of training. And we'll talk about this more when we get to what we'll call professional and legal considerations. That's a chapter in and of itself. So steps 5 and 6 are hospital care and rehabilitation. Hospital care is truly out of our hands unless you are going to be a physician. But basically, when the patient arrives at the hospital, either the nurses or the doctors and or the surgeons take that patient and provide care for their specific injury. But I think it's really important for us as aspiring clinicians really is this idea of rehabilitation. And to us, it really begins once they are released from the emergency room or the hospital. I think the number one goal of a rehabilitationist really is to return that injured person back to their previous state of health. Now, that might not always happen, and you might have the goal of maybe 90 to 95% of their health. But the cool thing about rehabilitation is this is what we are trained to do. This is what we are capable of doing. This is what we are good at, right? And it may involve other healthcare professionals. So it may not only involve your athletic trainers, it might also involve occupational therapists and or physical therapists as well. So I've been talking about your major roles as a first responder. However, one of the biggest deals and barriers to dealing with patients is really your characteristics, right? How are you when you interact with this patient? Are you kind? Are you stressed out? And so I want to give you some basic first responder characteristics that have been most successful when first responders are dealing with patients. And to me, one of the biggest ones is controlling your fears. I give the example of my foot fetish and my foot fear. For the longest time before I was certified as an athletic trainer, I cried at the sight of anyone's bare feet. However, when I was newly certified at the high school, an athlete came in and had a foot injury. He had athlete's feet, and I had to touch them. I almost lost consciousness because of my fear. I have learned since then to maintain my composure and to treat all patients. So one of the biggest things is controlling your fears, because if a patient sees that you are afraid, if they see that you are nervous, then it just makes the situation that much worse. I think another big component to being a first responder is to maintain your skills, to always keep them updated, to be dedicated to increasing your knowledge, right? I think the greatest clinicians, the greatest people who are good at what they do really don't become complacent. They always want to know if there's something better, if there's something new that they should be learning to keep their skills update. Last but not least, I'll talk about staying healthy. I think being healthy and being fit allows the first responder to care for and to treat patients more efficiently and effectively when they're out in the field. Some of you might say, well, what are my primary responsibilities as a first responder? We have a huge list of responsibilities. I think you can kind of look at this list and determine what your primary responsibilities are. But the most important responsibility, and I will not understate this throughout the rest of this class, is truly ensuring that the scene is safe. So this means you are looking at the scene, you are sizing it up, you're trying to figure out whether or not the scene is safe. One of the biggest precursors or the increase in risk of death for a first responder is the fact that they do not, for whatever reason, size up the scene. They do not make sure it's safe. I always tell people, my rule of thumb is a dead first responder is a no good first responder. So always make sure that you are surveying the scene prior to entering it. I think one of our other major roles is really summoning more advanced help. That is, of course, if a citizen responder has not done that. And then act within the scope of your practice, right? So you're going to provide care that you are capable and trained to provide. And then last but not least, please do not leave the scene of an emergency, okay? Even after EMTs have arrived and they've started to care for the patient, unless you are dismissed, always wait for the ambulance to leave the scene before you do. Your secondary responsibilities, once EMS has arrived, you can do several different things. One of the biggest things that first responders are known for after EMS has arrived is controlling and directing bystanders at the scene. So I give the example of a football player going down on the field and the entire stands rushing to the field and surrounding him. One of the big things that you can do is help control the crowd to keep the crowd back. If you notice that mom or dad, sister or brother are there, what you can also do is reassure patients. Never falsely reassure, so say, oh, they're going to be okay, but you can say all that's being done is being done, and you can reassure your patients in that manner, but never falsely reassure. A big deal is keeping records. Write down what you did, the care that you provided, and you really want to keep those for about 7 years because that's the statute of limitations. You have 7 years for a patient to come back and sue you for care that you provided. So you always want to keep records if you can. Keep them in your glove compartment, or if you're an athletic trainer or a physical therapist, keep them in a locked filing cabinet so that no one can steal them or burn them. So of the 10 components of an EMS system, we've talked about medical oversight. However, I think it's a little important, and so I think we need to go over it in detail. The specific component I'm referring to is medical oversight. This is when a physician is going to direct the care given by out-of-hospital providers to injured victims. So a physician is going to be responsible for all treatment given at the scene, right? So they are pretty much signing their life away. They're basically saying that they trust the EMTs, that they trust the first responders. And so a physician who directs the care that's given by out-of-hospital providers really is considered to be a medical director. A medical director is responsible for all care given. So if a firefighter gives care, if an EMT provides care to a patient that's out of hospital, if we were to provide care to someone who is out of hospital, the physician has signed a paper stating that he is responsible for all actions that we take. So when we think about treating patients, we also have to think about not only the patient, but also the other people that are responsible for the care that we are given. So you might say, well, what are the responsibilities of the medical director? Well, truly, it really is just to make sure that the people within the construct of the EMS system are trained, that they are effective, that they are good at what they do. And so the question I pose to you is an EMS system required to have a medical director? And you should say, absolutely, Dr. Cosby, yes, without a shadow of a doubt. Yes, it is one of the 10 components to the EMS system. So there are two different types of medical directorship that you can have. There are direct and there's indirect. If you have direct medical control, really what that states is that your physician wants to weigh in on every decision that is made. In other words, you have to contact that physician. You have to make some type of contact with that physician. So direct contact with that physician. That could be, he could be at the site. You could call him on his cell phone, but you have to get verbal communication from the physician that it is okay to do the treatment or to perform the treatment that you are going to perform on that particular patient. Some other texts, emergency response text, have termed direct medical care as online, base station, or immediate, but typically overall in the medical community we know it as direct medical care. On the opposite end of the spectrum, you have what's called indirect medical care. And this is really ideal for most colleges, for most healthcare facilities, is this indirect medical care. And what indirect medical care is, or what it states, is that you have these standing orders, so written rules, procedures, regulations that the physician has signed. So you don't have to call the physician every time you're going to treat. You just have to refer back to these policies and procedures. Now, most places would say that indirect medical control is one of the most ideal situations that you could have because it doesn't require you to get a physician on the phone. One of the downfalls to direct medical care is the fact that you have to locate a physician. Well, we all know that physicians are very busy individuals, and getting them on a phone to direct medical treatment and care could be very difficult. So most colleges and or universities tend to go with indirect medical care, which are written policies and procedures that both the physician and the healthcare professionals have agreed upon. So in summary, what we can say is that we have a chain of survival, and that chain of survival involves 6 components. The 6 components are the citizen responder, early activation of the EMS or calling 911, the first responder, right? Advanced out of hospital care, and rehabilitation. We've also talked about the EMS system and the components that make it up, and how those 10 components work together to provide higher quality of care to our patients in an emergent situation. We will begin next lecture with the legal ramifications for being a first responder. Have a wonderful day.